We are back! That's right, we are officially back. This is the Ethnic Health Disparities Podcast Show. My name is Dr. B, and welcome back to our show. This is show number 13. Show number 13, and yes, we are back. I know you've been waiting for us. This is show number 13, and this is the Ethnic Health Disparities Podcast Show. Thank you. Yes, it's been a little while since our last show number 12, and we took a little time off because we started a new podcast show on race and ethnic relations on campus. So we're back with the Ethnic Health Disparities Podcast Show. My name is Dr. B. Please email us at ejb678@gmail.com. Subscribe to us on iTunes, Spotify, YouTube. We're across the board. Also, Instagram us. Like us on Instagram. And we are officially back. Okay? Again, I just had to produce another a new podcast show. But I'm getting back to these set of articles. This article. And that's the reason why show number 13 is entitled Researcher's Bias. Researcher's Bias. If you go, and this gives us a little tie-in to you. I hope you return back to show number 11 and show number 12, because show number 11, number 12, we highlighted a very, very significant Center for Disease Control and Prevention report from Mortality and Morbidity Weekly, May 5th, 2017. Here's the title of the article. Vital Signs, Racial Disparities in Age-Specific Mortality Among Blacks or African Americans, United States, 1999 to 2015. Now this was such a remarkable article, journal article, that I did 2 shows on it, and this one is, again, entitled Researcher's Bias. Why do I title this Researcher's Bias? Well, one thing is that the findings in this article by the set of researchers, and I'm not going to name their names. But there was obvious researcher's bias in the reporting. And why do I say researcher's bias? Here's it. Let me just give you an overview, or just a reminder. Let me read portions of the abstract. Okay. Here's the background. Here's a portion of the abstract. Although the overall life expectancy at birth has increased for both blacks and whites, and the gap between these populations has narrowed, disparities in life expectancy and the leading causes of death for blacks compared with whites in the United States remain substantial. Understanding how factors that influence these disparities vary across the lifespan might enhance the targeting of appropriate interventions. That's paragraph number 1 in the abstract, and it's entitled the background portion. Now, what was so special about that? What was so special about that? Well, very specifically, it said the overall life expectancy at birth has increased for both blacks and whites, and the gap between these populations has narrowed. Has narrowed. That means decreased. That's remarkable in itself. And then when you continue in the abstract, just go to the next section is methods, and then the next section is results. Now, again, let me just read this. This is straight from their article, from the research team's article. Results. During 1995-2015, age-adjusted death rates decreased significantly in both populations, with rates declining more sharply among blacks for most leading causes of death. Again, rates declining more sharply among blacks for most leading causes of death. Thus, the disparity gap in all-cause mortality rates narrowed from 33% in 1999 to 16% in 2015. That's powerful. That's powerful statements. And again, that's just the abstract. That's the reason why this particular article in Mortality and Morbidity, CDC, caught my eye. And I said, oh my gosh, what is happening here? And obviously, they didn't spend too much time on those two particular elements, the researchers. And that's the reason why I say this is researchers' bias. There's substantial positives from their data analysis. Yet, they highlighted the negative. Yes, they highlighted the negative. I was amazed. And then, let me go to, again, and I covered this in show 11 and 12, but I think this is so significant that researchers' bias really come into play here. And what's so fascinating about this is that, again, they highlight it. You go to the results section, and they actually provide, obviously, the specificity. For example, in 1999, age-adjusted death rates for any cause of death were 1,135.7 per 100,000 for blacks and 854.6 per 100,000 for whites. Again, that's in 1999. By 2015, the racial gap had narrowed, with age-adjusted death rates of 851.9 per 100,000 blacks and 735 per 100,000 for whites. Thus, there were 284 fewer age-adjusted deaths for blacks, for 100,000 blacks during 2015 compared with 1999, whereas there were 120 age-adjusted deaths per 100,000 for whites. So, substantial 284 fewer deaths for blacks. This is significant. From 1999 to 2015, a much larger decrease in deaths per 100,000 for blacks as opposed to whites. This is remarkable. This is significant. And they said notable declines happen in heart disease, cancer, HIV disease, and cerebral vascular disease. So something significant. And I get back to this. Why did the researchers miss this? They wrote about it. They put the data in there. This is powerful data. Yet they looked the other way. They expected. And here's what I'm going to... Oh, yes, I'm 9 minutes in. 9 minutes, 10 minutes in. Yes, here we go. Here we go. Yes, I'm there. I would have to say that these researchers, 5 of them, six researchers missed this. For some reason, and I know the reason, this researcher's bias. They highlighted the negative. They missed a phenomenal opportunity. But the researcher, you got to realize, here's where it goes. All of us, let me just say all of us, every single one of us in the United States, in the world, but even particularly as researchers, scholarly academic researchers analyzing their data, we still come with our subjectivity, our perspective, our narrow perspective of life. And as a researcher, we still are very subjective when we are analyzing data, when we are reporting data. And I would say unequivocally that these researchers missed an opportunity and there was researcher's bias in the reporting, because they expected more negative than positive and did not highlight practically at all the positivity of this significant, earth-shattering, stop the presses. This should be publicized across the world. Everyone should know about these findings. But no, they highlighted the negative. They expected. No, let me just say, they expected. See, that's what happened in researcher's bias. We become so accustomed for certain groups, such as African Americans, blacks, to have poorer health outcomes, poorer states of health outcomes. But this data that they pulled together, all this national database, big data, huge data, that somehow they overlooked the positive and accentuated what they assumed what would happen all the time when looking at health data, mortality data associated with blacks, African Americans. That should not happen in 2019, 2020, and beyond. And here's what I'm suggesting. Yes, I'm suggesting. Before researchers, particularly at the national level, and I do know, I don't know who you are, but those who regularly publish your findings in the major national journals have the large data sets. Yes, I'm going to say it. Each and every one of the research teams and researchers need to reorient their perspective, because all of us, every one of them, have researcher's bias. And you have to be very, very conscious of how you report data from now on. From now on, because you missed a great opportunity when this was published May 5th, 2017. You missed an opportunity. You didn't have a final check on the ramifications of this significant publication. Someone should have checked you right before you submitted the final draft to CDC on this. And there should have been checkpoints. But no, the researchers, in their biased perspective, reported the data and did not highlight the significance of that positive data, this national data set, right in front of them. And did not ask one simple question. One simple question. What are the hidden factors that caused this rapid decrease in deaths among blacks, African Americans, as opposed to whites from 1999 to 2015? What hidden factors come into play That's a simple question. But these researchers did not take that basic step, that simple step. They assumed that they're going to focus more on the negative because that's what's there. And they kind of hinted on different programs, yet did not follow through. They hinted about the impact of the United States Department of Health and Human Services action plan to reduce racial and ethnic health disparities. They hinted upon the REACH program, the community-based participatory programs originating with CDC. That was it. So something with those programs more likely were effective. And so many others were very effective, significantly effective. Yet the researchers, in their biased point of view, still report the grim aspect of their findings. Because after they report this lowering of death, they specifically state, quote, however, despite substantive reductions in death rates among blacks in the United States, blacks continue to have higher death rates overall, higher prevalence of many chronic health conditions, and lower prevalence of some healthy behaviors. Then it goes on. They immediately switch to the expected. And they didn't spend any extra time on the unexpected data results, the unexpected findings, the new discovery in this big pool of data set. That is researchers' bias. And I posed a question to the listening audience. Oh, here we go. I posed a question to the listening audience. How many of you feel that the reports that you hear, see, read, published, have varying degrees of researchers' bias in these reports from national journals, respected journals, respected research teams across the United States? How many of you feel that there is researchers' bias in the reporting, where unfortunately the researchers are taking their findings, interpreting their findings from their perspective, their limited perspective, and just don't stop and ask simple questions? What is it like to report the data from the group's perspective? We do all this analysis on various racial and ethnic populations, health status, but let's make sure we include people, researchers of the community, and ask their opinion about your reporting of the findings. Do a double check. Do a last minute check with scholars of the same community and get their input. That's all you have to do. Get their input. Because guess what? If these researchers sent their draft to me, if I saw this, if it came to me, I would have said, hold the presses. I would have said, hold the presses. Stop right there. You need to report. You need to balance this out with more of the positive hidden issues in this study's findings. So what is still happening in United States and reporting of data, particularly in this particular article, Vital Signs, Racial Disparities in Age-Specific Mortality Among Blacks or African Americans, United States 1999 to 2015, what is still happening is researchers' bias. We must now call these types of issues out. So researchers now and in the future will do a double check. We'll try to get input from outsiders. We'll try to, guess what, get additional training in examining the data sets, interpretation of the data sets, and how it's presented. Now, I do know CDC has checkpoints. Most federal agencies have checkpoints. They have committees to review various publications again and again before it hits the presses. But when you're in many times, research teams from different universities do not have those checkpoints. And I can say this because I used to work for the federal government. And I know there's checkpoints. But in university environments, research institutes, there's very few checkpoints. And there's more researchers' bias out there. That should not happen. Particularly when when there's still lots of new reporting on racial and ethnic health disparities in our country. So again, this show is entitled Researchers' Bias. It's still very relevant today in 2019. And we need to put a stoppage to researchers' bias. Reduce researchers' bias the best way we can. And I'm calling on each research team, before you report your significant studies findings, ask simple questions of people, persons, agencies, groups, organizations that represent your studies findings. It would be much more refreshing. And you'll get a culturally competent publication that way. More of a culturally competent, respectful publication. That's what we really need in 2019 and beyond. So there you go. This is show number 13, Researchers' Bias, the Ethnic Health Disparities podcast show. My name is Dr. Bailey, Dr. Bay. And again, if you have any questions, any comments, email me at ejb678@gmail.com. Like me on Twitter. Like me on Instagram. Check it out on iTunes, Spotify, YouTube. We coming strong. We got another show after this one on the same article again, because this is a phenomenal article. So thank you for tuning in. Peace out, folks. We out.